Is skepticism undermining the United States vaccination success story? About 250 million doses have been administered so far. Almost every second American has received a shot in the arm. A third are fully vaccinated. But the pace is slowing, which has experts worried.
5 or 6% could be the difference between, really having protection as a society versus still having a lot of active cases out there.
Without herd immunity, it'll be harder to stop the coronavirus from always making comebacks. Officials say the sudden slowdown in vaccination rates are due to some Americans refusing to get their second shot. They're worried about the side effects. The hesitancy and skepticism is stubbornly high among Republicans and white evangelical Christians, but more black Americans are lining up for the jab. DW's Carolina Chimoy reports.
There are over 30 vaccination sites in Jackson, Mississippi, a city of 160,000 residents. One of the locations is at the State University site. Empty chairs and an awaiting staff shape the scene. They have 250 doses of the vaccine available today.
Sometimes we have to waste them. And that's a shame because we know that there are many more people that need to be vaccinated.
Mississippi is last in the United States in COVID-19 vaccinations. Only 26% of the state's population is fully vaccinated. Some have changed their mind, but vaccine hesitancy still poses a major problem.
I was very hesitant, but once I thought about everything, kind of prayed about it and kind of gave it some thought, I felt like this was the most responsible thing to do.
Be safe with my family and people around me, and I work around a lot of patients every day. So,
at Jackson Hinds Health Center, Dr. Chapman and her team offer daily vaccines for free with no appointment required. But also at this site, the traffic of patients remains low.
We find in the South that a lot of conservative whites are not getting it, and then a lot of the minority young is not getting. And we try to just give them more and more education.
Even some health workers are hesitant, like Barbara Patrick, who eventually was convinced.
Would you like the Moderna, the Pfizer, or the Johnson & Johnson?
Moderna. Realistic.
As a health worker, she was offered the vaccine in January, but didn't want to be the first in line.
Oh, that wasn't bad.
It was not that I was anti-vaccination, but my hesitant was because I wanted to see what the outcome of others would be first.
With every shot of the vaccine, the risk of the spread returning dramatically decreases, but this is still not enough. The city of Jackson has decided that if people don't attend the vaccination centers, they are going to bring the vaccines into their communities. In a mobile clinic packed with vaccines and supplies, the health workers drive 4 to 5 times a week to the suburbs. The goal is to make it as convenient as possible for people to get their vaccine.
Good morning, how are you doing? Okay.
Today it's a church. After 2 hours, only 2 members of the community come in to get their shots.
That's it?
Yes, sir.
I work at night, and it's very convenient for me to come in the community in the day so I can come in and take my vaccine shot.
This time there are 100 vaccine doses available, a much-needed tool and wanted around the globe. But demand here is quite low.
Some are still hesitant, but there are some who have barriers like transportation. We don't require appointments, so it makes it more convenient.
But hesitancy is not only about convenience.
Maybe they're trying to use people of color to get the vaccine, to really do some research. That's one of the things even I thought at first.
Facts and statistics convinced her that this is the only way to return to normal, also in their church.
And let's bring in Monica Gandhi, a professor of medicine at the University of California. Monica, great to see you again. Since we spoke last time, I don't know if things have really changed. Why is there still so much hesitancy and resistance over this vaccine?
I think there are 4 reasons, and you just illustrated some of them. One is in communities of color, which traditionally in the United States have had a mistrust of the medical system. We have to work harder. We have to work with communities to do the messaging, church-based messaging, things that you just talked about. The second is distrust of the government. And we're a very polarized political country. And right now this is being rolled out in the Biden administration, even though it was made in the Trump administration. And that, I think that's the reason the CDC said you don't have to wear masks after vaccination. I think they're actually trying to motivate Republicans right now that are not sure about it. And then I think there are people who are just simply, it's inconvenient. They will get it when they get it. The young is among them. And then I think people are waiting to see if it's safe. And I do think we will get there, but it's work. It's hard work.
So what's the hard work that governments need to put in?
So what President Biden is committed to is the hope is July 4th, 70% of people will have gotten the first dose. Changed from a system where we have mass vaccination sites, which we used to have, and now going out into communities, which you just illustrated. So rural communities, putting it in doctors' offices where people have trust of their physicians, longstanding relationships they can talk to, putting it in pharmacies. So this is called a spoke model instead of the hub, that going out to actual communities. It's California put in $33 million just for this. Campaigns for people to educate each other. This is actually no longer just putting up a site and hoping people will come. Now it's actually work to think about how to message differently. And I actually think that's why the CDC gave us this message that you can have a normal life after you're vaccinated, no more mask. I think they were trying to motivate.
Dr. Anthony Fauci says herd immunity is still somewhat of an elusive number. Can you be any more specific? I mean, that's what the aim is here with the vaccine, isn't it?
It is. Herd immunity in the traditional infectious disease definition, I don't think is elusive. What herd immunity means is that you get enough of the population vaccinated or immune by natural infection, but hopefully vaccinated, that anyone who's unvaccinated is protected by other people's immunity. And what it's reflected in is getting lower and lower cases with higher and higher vaccination rates, so that a child who can't get vaccinated is protected like they were in 2019 by very low cases. When we look at Israel, when we look at the UK, they have such low cases, even as they're opening up, with a first dose rate of 64% and 54% respectively, that I think we'll get there. I think that Europe will get there.
You think they'll get there? But Monica, what happens when all these countries open? What about the fact that every country is moving at a different pace? South Korea set a goal of reaching herd immunity by November, but shipments have been slow. German officials hope herd immunity by autumn, but caution the disease will not have disappeared by then. I mean, isn't it just going to keep coming back and coming back because it'll disappear in one part of the world and reappear elsewhere?
There's no doubt that global vaccine equity, there's no doubt that getting vaccine to poor countries and places that need it is the only way to truly get to herd immunity. Absolutely. It will keep on cropping up. And that's why there's nothing more urgent right now than to getting the whole world vaccinated. This is unfortunate that coronavirus happened, but we actually have a tool that is not that expensive to get there.
What gives you hope, just briefly, that we can beat this super bug?
What gives me hope is that there are 4 countries that are going fastest. The United States is the 4th. Bahrain and Israel and the UK are 1, 2, and 3. And they are opening. They're actually opening. People are seeing each other, and cases are staying low. I also think the coronavirus does not mutate. I know it seems like it mutates a lot because it was transmitting a lot. But once we get the numbers down, I don't think it doesn't mutate like influenza does. This is an RNA virus that has a very strict proofreading mechanism. My hope is that these vaccines are incredibly effective and we can get it if we all work together.
Monica Gandhi, thanks for being on the show again.
Thank you.
And it's that part of the show where our science correspondent, Derek Williams, answers your questions on the coronavirus.
I've been vaccinated and feel some side effects. Am I contagious to others?
Pretty much all of the vaccines approved so far in various parts of the world are fairly reactogenic, which means they often cause mild side effects like pain and swelling at the injection site, as well as things like fatigue or headache or fever or chills or aching joints. By some estimates, about 2/3 of all recipients report those sorts of effects soon after having a shot. They generally disappear within a day or two. Side effects appear to be more common in women than in men, and also seem to happen more often in younger recipients than in the elderly. But side effects aren't caused by live virus replicating in your body, because the vaccines in use don't actually contain any live virus. Instead, they employ a number of different tricks to fool your immune system into believing you've caught the virus. Many vaccine platforms work by delivering genetic instructions into your cells that cause them to build SARS-CoV-2 proteins. These harmless components teach your defenses to recognize the virus without real exposure to it. The available Chinese vaccines accomplish the same goal by using chemically inactivated or disabled virus to put the immune system on red alert. But because vaccines don't expose you to live virus, they can't give you the disease, hence you can't be contagious, assuming, of course, that you didn't catch COVID-19 for real from someone in the days between vaccination and the ramp up of your immune response. The sometimes unpleasant vaccine side effects, experts say, are actually a kind of confirmation that your immune system is reacting as it should.